those for free too. Most of those often revolve around diabetic substances. And controlling diabetes and diabetic supplies are a big reason why clinics are put in, because that improves outcomes there, and they're able to acquire those substances for less. Everything I told you, I could have another of my customers come up here, because they're forced to listen to me on occasion as well, and tell you the same story. They'd be happy for you to do that. But, you've got to validate, that this is true. This is good. If your mayor's doing a good job of pressing me and talking to my customers and talking to other governments to do this. Having said that, is there anything else? Is there any questions?
I will make a couple of statements first, and then I'll recognize everybody for questions in order. Please take some time to talk to some of your counterparts, maybe in Hamlin County or Washington County, and ask them how this has happened, and maybe get more than just one person's opinion, so you get a good synopsis of that, or Tullahoma. Also, Keith Hayes over at Viam, most of you know him. If you don't, you're missing a great opportunity in life. But go see his clinic and the reason he put it in and how it operates, and the positives that it's doing for his attendance and for his insurance. And as Mark said, the first year we're going to see a bit of a savings, and I believe may get this briefing here in a minute, but that savings almost will pay for the clinic, minus the build out. These guys, they handle the medical liability insurance, they handle the payroll, they do all that. So we're not liable as a county for any medical emergencies such as that. We will need to do the build out and create the proper atmosphere. Also, Batesville Casket has one right outside their main gate. Go and ask to look at it and see how it operates and see what it looks like. Warren County now has one, which is a detriment to recruitment for us if we don't modernize. Us having a clinic will be a great recruitment and retention tool. We won't see so many local agencies in other counties cannibalizing our employees, because we'll have this great benefit. And so getting predictability in our costs from a budgetary standpoint, knowing at the beginning of a budget year that our health insurance costs will not be any higher throughout that year, I think is something that is extraordinary. And by the way, Mariana has been in every one of these events. She happens to be on vacation right now, but she's been with us the entire time also to listen to all the various presentations from the different companies and from Mark. And I just encourage you to look at it very hard. This is a big leap, but it's also self-control. It's taken our health care into our own hands. And it's not like we're going to have to micromanage our employees, but they're still going to be able, they can go to Walgreens if they want to, they can go to Markham's if they want to. We want them to go wherever they want to go. But at the same time, we can help through our department heads and other elected officials. And by the way, I did get the sheriff green light on this, because he does have the most people, and I just wanted him to make sure that he looked at it closely, and he was enthusiastic about it. But it allows us to control the utilization of a lot of our health care costs, our workers' compensation costs. We get a physician to see a first injury to make a diagnosis of it. Anything emergent is going to go to the emergency room, obviously, but anything else we can control. We can control the hours of the clinic. We could have some evenings that are better for some people. We can have a Saturday once a quarter for sports physicals and kids or whatever. We can do any host of things. And I believe, Mark, we're eligible to afford somewhere in the neighborhood of about 32 hours a week, open and operational with our size. So I just encourage you to look at what's going on around us and look at some of their success stories. Kasai and Viam both have a partnership, but Coffee County is big enough to be able to support this. We have the room to be able to support it. The plumbing's already in there. It's going to take a little bit of money, obviously, for exam rooms and waiting rooms and all that, but I think it's there. If this commission has the vision to do it. But now is the time for you guys to start seriously thinking about making a decision about empowering our committee system to move forward with this, if you so choose. So that's what I wanted to say, and then Commissioner Chairman Seaborn, you had a question.
Yeah, I've got a comment actually, then, and a question at the end. So a few years back when I was working for a different corporation, Dianetics in Huntsville, which at the time was an employee-owned company. They've since been bought out. And I worked for them for 13 years. They had self-insured, I think, maybe not the whole time, but for at least the 10 years I was there, they went to a self-insured plan, although they did have a Blue Cross Blue Shield administration of that. But probably 10, 12 years ago, they put an office right in they've got a campus down in Huntsville in the middle of the all the big corporate park down there. And they've got a pretty big, good-sized campus now, 3 or 4 buildings. They put the doctor's office right in the front entrance of the corporate headquarters, which was not a secure area because it's a defense company. It was the most popular thing they'd ever done. And I actually ended up never using it because I didn't work on that campus except for a few years. And the few years I was there, I never got sick the whole time, so I never went in. But I remember one of my previous bosses, she was a VP upstairs, and she was like, yeah, once a month or once a year for her physical or whatever. She goes downstairs at a pre-appointed time, walks in, she's there 15 minutes, walks out and is back in her office in 5 minutes, which she was a workaholic, so she loved that, right? The other thing that, though, and I didn't hear you mention, but I think it's worth mentioning, since we were an employee-owned company, all the money being saved from that was going into the value of the company, which enhanced all of our stock options because everybody in the company owned stock because it's an employee-owned company. And so that was another part of it. It was just to sell it, is that every time you use that office, you're saving time, you're saving money, and you're increasing the value of the company. And I think that's a message we probably ought to get across to our employees. This is not, you shouldn't just use this just because it saves you money now. It's going to save you even more benefits money in the future. And so there's a motivation factor there and I'm sure you guys are aware of that. But it was just very, very successful in their office. So I'm a fan of this kind of idea. The one question I have, I think I know the answer, but just in case it occurs to anybody, talk about employee health record security. Is there, if the boss is paying the bill, does the boss get to find out about your health care?
Just like when you go to your doctor's office today, your employer knows maybe that you went to the doctor's office. That's all they're going to know in the future. The same laws, the same protections, the same computer firewall situations have to exist in this situation. There is no exception to that. That is a sacred place, the physician's office, and all the HIPAA guidelines, all the cybersecurity guidelines, everything that is followed in your doctor's office today or a hospital is followed to a T, and maybe I would say even better in some instances because it's more focused. So there is no universe that data could ever end up in this employer's hands at all. Also, when it comes to privacy, the member's going to have more access to the information about themselves through their phone. They'll be able to see their records, share their records with their other physicians if they wish to, and that's part of what comes with this, is access to their information that they own.
Yes, sir. Commissioner Hirschman.
So let's go to the drug part of it. So if the on-site clinic will handle the drug and there'll be a zero cost, we'll say a zero cost. So if they go from on our on-site and go somewhere else, like Walgreens or somewhere, or Walmart or something, is there going to be a cost associated to that then?
Yeah, if they go to the Walgreens, like they've always gone to Walgreens, then they'll pay whatever the health plan says the copay should be.
Right.
But
Okay.
if that same drug can be filled at the clinic, they'd be better to give it at the clinic.
Exactly. That's what I wanted to ask.
Yeah, and I'm told that Walgreens is the most expensive place to get anything filled, too. So,
They're not chained to that, they know it.
yes, Commissioner Morris.
Appreciate the presentation. I really look forward to hopefully getting a health and wellness center. Does Tullahoma have a health and wellness center?
They do not this time. In fact, because we're in a public session, I would say, we're having conversations.
Thank you.
And there is the option in the future of us, if we choose to, co-opting with other government entities for a health and wellness center. We give up some ability to retain employees that way maybe, because folks might want to leave again because they can go to another one. But that's a decision this commission can make. The more people we have participating in it, of course, the more hours the clinic can be there and the more economy of scale. But we have enough to get started now. We have a very good number to get started with ourselves. But I have had informal conversations with, and not that I initiated, with at least one school system in the county and one other city that would like to be interested in doing this too. But we have to do it first ourselves, and then we have to decide if it's something we want to open up if we choose to do it.
If I could comment to that. Yeah.
Sure.
One of the ways we actually got into this was through collaboration with Toyota Two Show and other local governments. The original collaboration in Greater Cincinnati now has 16 different employer groups participating, 3 of which are private industry. And one of them is a significant size private industry, the airplanes parts manufacturer that uses that facility. So I say that this can be a benefit to the community in total. Those organizations which participate. So sharing health and wellness centers is a common practice and it's a good practice. And I didn't hit on workers' comp and occupational health, because I didn't want to complicate things, but that is an option for these as well, to assist in that arena as well. I call that phase 2.
Well, and that can be one of our biggest expenses, to not controlling that properly. And I know that's why a lot of private businesses first got into clinics, was to control workers' compensation, and then that merged into a lot of other things, the folks I've talked to. But I've been very pleased with this group. I know you have some other speakers. Would they like to say something very quickly, or you might have covered it all?
Sure. Yeah. So it's hard to follow up Mark because he's does this to me every time. But I would reiterate the fact that on this commissioner, okay, it will be your employees' most valuable benefits without a doubt. And a lot of this is repeat, but recruiting, retention is a huge factor of the clinic. And our particular model, Symbol, is different than some of the other clinic models out there in the sense that you only pay for what you use. So you're not paying Symbol a management fee, where if we see 30 patients in a day or a month, you're going to pay us for 30 patients. You're not going to pay us a flat rate where if you don't use it, you still pay that amount. So it's all based on utilization, which is more of a customer-centric model. We're partnering with Coffee County to offer this service, and like I said, I think it will be one of your most valuable benefits.
Thank you. I'd like to encourage any commissioner that, go home tonight and you come up with a list of questions, or you discuss this with your family or some of our county employees, make a list of questions and get them to me, and I will get you answers from Mark very quickly. Post haste. So, Commissioner Morse, you had something else?
Yeah, just curious, does this cover county retirees?
It would be our decision, so we would just have to look at what impact that might have on the overall number. I think right now we have very few, 2?
I think it's 2, right?
I think we only have 2 or 3 retirees now, so it's not a substantial number that are using our health plan. But this, once again, will be something the commission decides, but I think it's in play. For sure.
That number of retirees does not impact the circumstances at each significant level, so fine.
Any additional questions or comments? Remember, the fair's going on tonight. Run by the fair. If you get a chance, that's where I'm going to head to. But Mark, you and your team, thank you so much. You guys have really been great. You've made a lot of trips here. You've met with everybody that's asked to meet with you. And you've given us great information, and I cannot thank you enough. And if we don't, oh, yes, Commissioner Brown. Sure. Yeah, Heather's been in all of these. We just haven't been real pleased with the service that we've received since I've been here. And I like to have a little better, for sure. Well, thank you, sir. And without any further business, any announcements? Remember, we have a full commission meeting on September the 12th, and we'll have a few things to do there. I know we're going to, so look at your agendas as they come out, some resolutions, some new committees stand up, things of that nature. But not seeing any other business before us, no other announcements. Can I have a motion to adjourn?
Make a motion.
So moved. We're adjourned.